Hi, this is Lindsay Sullivan back live at Bone and Joint Institute today with Dr. Brian Perkinson, so welcome. We have to give a little shout out to Dr. Perkinson's socks today. He is our sock guy and he's got some very interesting ones going on, but collector of all things socks. So
these are the Iron Pigs, minor league baseball team out of Pennsylvania.
Perfect.
In the area my wife grew up.
Excellent. Love it. Love it. Well, Dr. Perkinson, thank you for joining us today. Today we're talking about a thing called Unicompartmental knee replacement. So long word, but Dr. Perkinson today will kind of lay it out, let you know what it is and where we go kind of in treatment. So Dr. Perkinson, before we start, give a little bit of background on yourself and explain what you do with your practice.
Perfect. Thank you.
You're welcome.
My name is Brian Perkinson. I guess I'm a little bit of a unicorn in the area because I'm from Franklin. At least people tell me now I'm a unicorn. But I am from here. I grew up in this area just down the street, went all through the Franklin Public Schools, and then ended up going to BGA. I graduated from BGA sometime in the mid-90s. And then went to the University of Tennessee. I'm a volunteer. Got a degree in engineering, went into biomedical engineering, spent some time in that field, and then decided to go back to medical school.
Okay.
Went back to medical school. Decided to stay in orthopedic surgery, and then developed a fellowship, or went to a fellowship to develop my practice in what is primarily joint replacement, so primarily hip and knee replacement.
Okay, excellent. So while we're talking with knee replacements, the big word that we just mentioned was unicompartmental. So we'll get into that in a minute, but anytime you have a knee replacement, you're dealing with arthritis, is that correct? So go into a little bit of detail. We kind of know what arthritis is, but just about knee arthritis and what would lead to this type of knee replacement.
Sure, there are other things that could occur that could lead to a hip or knee replacement, but in general, the majority of it's going to be osteoarthritis. Arthritis is a word generally used to mean joint inflammation. Osteoarthritis is the word that we use to mean the basic wear and tear or degenerative arthritis that occurs to all of us over time.
Okay.
And essentially, you kind of have the cartilage that you have when you grow up, and that's the cartilage you're going to live with. And cartilage is the bearing surface on which your joints work. Okay. And over time, that cartilage will wear down. So a lot of people think of osteoarthritis as something in your knee. It's actually not something in your knee. It's something that leaves your knee, which is your cartilage. And then that leads to your bone being exposed and causing pain and inflammation in your joint.
Okay.
And so what we end up doing in some type of replacement form is we resurface that bone with metal and plastics and ceramics.
Okay. But before the surgery, are there non-operative options that you can do? Could you briefly describe some of those?
Yeah, so basically you can't change the nature of your cartilage. Genetics plays a role in this. If your parents had arthritis, there is a probability that you're going to have arthritis. If you have an injury, it could be post-traumatic arthritis. There are other types of arthritis, such as autoimmune diseases. People may have heard of rheumatoid arthritis. But if you're referring to osteoarthritis, the majority of our treatments are going to be healthy lifestyle, so healthy weight, non-impact healthy activity, heat or ice when you have flare-ups, medicines that you can take by mouth, medicines you can put on topically, or medicines that you can inject into the knee.
Okay.
The ones by mouth are primarily anti-inflammatories and or Tylenol. There's whole families of those.
Okay.
The ones that you inject in the knee are primarily three types: cortisone or corticosteroids.
Okay.
Gel series, commonly called, but it's really hyaluronic acid. It's a lubrication type injection. And then platelet-rich plasma, which we do provide here at Bone and Joint Institute, where we actually take special properties of your blood and return it into the knee to try to decrease inflammation. And then topical creams, which tend to be various types of ointments, and it's a huge family that we won't get into, but that's the primary treatments for arthritis until you get to a point where none of those are working, and your lifestyle has become limited and governed by your joints. And when you get to that point, we start talking about surgery.
Surgery, okay. So that was kind of my next question, when is it an option? So as far as now, let's talk about the unicompartmental or the partial knee replacement. Who's a candidate, and why would you need one over a total knee replacement?
So this can be a little controversial in orthopedic surgery. Okay. Because the reality is number one, there are many people who are candidates for partial knee replacement. Estimated to be about 20 to 30% of people with knee arthritis would be a candidate for a partial knee replacement. So let's first say what it is before we talk about its candidacy. So we talk about unicompartmental. What that means is there's three main compartments in your knee. There's the one under your kneecap, between your kneecap and your thigh bone, we call patellofemoral. There's the one on the inside of your knee that we call medial, it just means inside.
Okay.
And there's one on the outside of your knee we call lateral, which means outside. Those three compartments make up spaces in your knee where the bones rub together and articulate normally. So if you just replace one area of that knee, we call it a partial knee replacement,
Okay.
or a one compartment knee replacement. And so there's three of those types. The most common being the one done on the inside of the knee. That's by far the most common. Over 90% of them are the ones done on the inside of the knee. So we think about 20 to 30% of patients with knee arthritis are actually candidates for partial knee replacements.
Okay.
But the number one thing that makes you a candidate for the partial knee replacement is you have to go to a surgeon who does partial knee replacement.
Okay.
So that's the number one thing. If you,
Okay.
And because a lot of surgeons just never trained on it, they don't do them, or they may personally feel that they don't work as well. My opinion is for the right population, partial knee replacements work extremely well, and I believe they actually work better than full knee replacements in specific patients. And so I separate those two concepts. There are patients who are good for partial knee replacements, and there's patients who are much, much better for total knee replacements. And understand when we talk about partial knee replacements, we're not talking bad about total knee replacements. Total knee replacements work extremely well, and I do many, many more total knee replacements than I do partial knee replacements. But I still do a lot of partial knee replacements, probably about 75 or more a year, which is about 30% of my knee volume.
Okay.
So what makes a person a partial knee replacement candidate? Number one is that the majority of your arthritis is focused in one area of your knee. Number two is that your knee has a good range of motion, that functionally your knee goes almost completely straight and bends back deep.
Okay.
And number three is that you don't have large deformities. Your knee's not crooked. Your knee's not misshapen. If you fall into that category, then very often you could have a conversation about a partial knee replacement.
Okay. And is a partial knee replacement typically an inpatient surgery? Is it typically an outpatient surgery? I know there's different types.
It is almost exclusively an outpatient surgery.
Okay.
And so the vast majority of partial knee replacements go home that day. The caveat to that would be if you did a partial knee replacement in an older population with a little bit of heart disease or kidney disease, you may want to watch them overnight one night.
Okay.
But the vast majority of them are done outpatient.
Outpatient. Okay. Excellent. And so you've had the surgery, you've had this partial knee replacement. What's the recovery time look like? What is physical therapy needed, or what do you need in the weeks or months after this procedure?
So you do physical therapy, and it's still a recovery. It's still a knee replacement.
Okay.
It's not as large as the total knee replacement. You're maintaining more of your knee mechanics, so all your ligaments are the same. 70% of your knee is your normal knee. The only thing you've really done is resurface the area of the knee where you have the bad arthritis. That's what allows you to have more normal knee, what we call biokinematics, more knee kinematics, where you can go through a normal range of motion, and you can do it quicker. So you still have to do therapy, you still have to recover, but your therapy is somewhere in the range of 2 to 4 weeks, as opposed to 6 weeks plus for, let's say, a full knee. I tend to tell my patients that, and everybody's different, there's kind of a bell curve of normal, but most patients get better about 4 to 6 weeks faster with the partial than they do with the full.
Okay. And if a patient has a partial knee replacement, are they a candidate potentially for a full knee replacement in the future?
Yes, absolutely. So that's a good point. That's one of the advantages of the partial knee replacement. So I very much like the partial knee replacement in my young population. And let's just label young as a joint surgeon would be in my 50s. Okay. And if I was to say my older population, I would say, let's say 70s and above.
Okay.
My mid-range population for a joint replacement is going to be in your 60s. That's kind of the sweet spot.
Okay.
So in your young population in the 50s, it's a great opportunity, because if the average person is living mid to late 80s, you can't really guarantee that any surgery is going to last 40 years.
Okay.
So you could have a full knee replacement,
Okay.
which then at some point would most likely need to be changed into a revision full knee replacement.
Okay.
And that's a pretty big surgery. Or you could have a partial knee replacement, which doesn't change your success with a full knee. You could come back in and basically just take out the partial and do a full knee replacement, and you could have the same outcome as if you did a standard knee replacement. So I think it's one of the selling points of a partial knee is that if you're a candidate, it's a very good opportunity to be bone conserving, maintain better knee motion, have a faster recovery, get an outpatient procedure, and then if one day you need another surgery, we have that for you.
So we're not burning any bridges.
You're not burning any bridges. And a partial knee replacement lasts 15 years, 85% of the time in the modern data that we're using now with the way we do these. And the other thing that's interesting, I also like it in our older population. So in our population 70s and above, it's nice, because in general, partial knee replacement is going to last you 15 years, 80 to 85% of the time. So if you give that to a 75-year-old, on average, it's going to last them the rest of their life, and thereby you've given them a smaller surgery, a faster recovery. And the studies also show that because it's a smaller surgery, you have less risk. There's lower complications such as heart issues or major morbidity complications.
Excellent. Excellent. Well, thanks for giving us the kind of the detail of unicompartmental knee or partial knee replacement. It's kind of, those words can be used kind of interchangeably. But what are your tips for, if you could give 2 or 3 tips for preventing arthritis? I know some heredity you can't really prevent, but what are other things people can do to prevent getting to this point?
You know that the number 1 and 2 things are maintain a healthy weight and a healthy non-impact exercise. Diet, exercise, healthy weight, there is no quick fix for that. There's really no pill, there's really no magic wand that's going to replace that. You can do things that are commonly called nutraceuticals, which may be glucosamine chondroitin, it may be turmeric and things like this. They're not really going to prevent arthritis. They may help with inflammation, they may bring down symptoms. But the best way to prevent arthritis is to maintain a healthy lifestyle, healthy weight, and good nutrition.
Excellent. Well, again, thanks, Dr. Perkinson. One question that I always end these Facebook Lives with is, describe the comprehensiveness here at Bone and Joint. What do we have here in this building that gives us just the great experience for the patient?
I think the number 1 thing we have here is a full team of individuals, from our administrators to our clinical individuals to our doctors to our physical therapists, who care about patients and care about the patient experience. We can talk about all of our skill sets and how good we are at doing these things, but I think when patients come here, what they get is timely care, they get efficient care, they feel like their time mattered, and they leave with all the information that they wanted. Now, when you go beyond that, absolutely, we have imaging in-house, we have physical therapy, occupational therapy, we have an amazing facility, we have durable medical equipment, we have our full-service ambulatory surgery center downstairs. With 2 floors of clinic space. In our surgery center, we cut no corners. We have the most advanced robotic technology that I use for a partial knee replacement that I think is going to provide people even longer outcomes of success. So I think we just have kind of your one-stop shop for everything you need orthopedically and musculoskeletal here, and we can basically have everybody available to serve any musculoskeletal need that you have.
Excellent, excellent. Well, thank you again. Again, Dr. Brian Perkinson talking about unicompartmental knee replacement or partial knee replacement. So for more information or to schedule an appointment with Dr. Perkinson, you can give us a call at 615-791-2630 or also on our website at boneandjointtn.org. Thank you again, and thank you for tuning in. We'll see you next month. Thank you.
Thank you.